My name is Ashley Wharton. I work at Bayada Home Health Care. We're a large home health care provider in multiple states, probably over 23 at this point, with offices around the country.
Best part working with this company is I have my documentation that is to be done on a tablet using SwiftKey software.
We've got 20 volunteers, 20 clinicians who volunteered to try it. The feedback was so overwhelmingly positive. We pursued the next kind of course of action and got a version to deploy to all of the clinicians.
This was the first time I was introduced to SwiftKey by my colleague, and I came to the office. I told my client manager to get it installed right away, and since then I've been using it, and it's wonderful.
Once they are using it, the feedback is tremendous. They wouldn't give it up. But just rather than abbreviations and the typical, like, very short, concise text type messages, this is actually full sentences and full paragraphs, and it lends so much more meaning to the whole picture.
The words we use in documentations are very precise, and they need to be formed with a particular sentence. It understands what needs to be documented when.
Having the medical terminology in there, the most complicated medication will be accurately predicted and accurately spelled. When it comes to patient safety, getting that information correct is obviously critical.
If I go for an initial evaluation which needs very detailed documentation, it actually saves around 8 to 10 minutes for every patient. And if I see around 7 to 8 patients every day, it saves me an hour.
So the easier we can make that documentation and allow the clinicians to do what they want to do and do best, which is care for the client, the benefits are significant in terms of employee satisfaction, employee retention, which ultimately probably also gets reflected in the care that they're able to provide to the clients. And to date, I think we're at over 15 million keystrokes saved. It's kind of mind-blowing.